Dr. Science. So today our topic is going to be about choanal atresia. And in this video I will be mainly talking about the differences between chona and concha, or how the clinical diagnosis is made, and what are the CT scan findings, and what is the treatment to be given in this patient. Okay. So first of all, many people think that chona and concha are the same, but chona and concha are completely different. First I will talk about the concha. Concha is nothing but the mucosa plus bony part of the turbinate. Okay. So suppose that this is the lateral wall of the nose, and here is your nasal septum. From this nasal part, from this lateral part of the nose, or the lateral wall of the nose, there is an extension of the mucosa. So this is the mucosa, right? And in this mucosa there is a bone present. So this bony structure together with the mucosa is called as your concha. So concha is nothing but the mucosa together with the bony part of the turbinate. So that is meant by concha. Whereas chona is the posterior opening of the nasal cavity. Okay. Suppose this is the face of the patient, this is the nose, and these are the lips. This is the eyeball of the patient. So usually every students note that we have the nose or the nasal cavity, and here is the oral cavity, and both of them eventually drain into the pharynx. This part where the oral cavity ends is the oropharynx, and this part where the nasal cavity ends is the nasopharynx. Okay, so this part is oropharynx, and this part is the nasopharynx. And as you can see here, this is nothing but your concha, which is the posterior opening of nasal cavity. Okay, now what is happening in choanal atresia? Choanal atresia means like narrowing of the passage, or complete closure. Stenosis is narrowing, atresia means complete closure. Okay, atresia means there is complete closure of the lumen. Okay, so what is happening? So in this patient, this opening is getting closed, so obviously the patient cannot breathe, right? The air cannot pass into these patients through the nasopharynx or through the nasal cavity into the lungs. So in choanal atresia, usually choanal atresia, it is a congenital disorder. Okay, and usually the neonate will be cyanotic. Cyanotic means he will be in blue color because the air is not going. Okay, so the clinical picture of the patient is like a neonate presented to you. Okay, he is cyanotic or blue in color. Not only that, in the exam they may be asked failure to pass the suction tube. Okay, failure to pass the suction tube. These will be presented in the question paper. Okay, it will be like a newly born neonate having who is cyanotic, failure to pass the suction tube, and not only that, this patient on crying turns pink. And why is that? I would like to explain that. Suppose this is the nose of the patient, these are the lips, and here is the nasal cavity. Okay, this is the nasal cavity, and unfortunately there is atresia here, so air cannot go in. Neonates are obligatory nasal breathers. Okay, they cannot breathe through their mouth. Okay, they need some time to breathe through their mouth. Okay, so obviously these patients or these neonates are breathe through their nose itself. They cannot breathe through their mouth. Okay, so when the patient cries, if the patient is crying, what happens? The mouth gets open. Makes sense, right? When the patient is crying or the neonate is crying, his mouth is open, and through that he sucks air. When he sucks air, the blue or the cyanotic patient is going to get turned into pink. That makes sense, right? So in the question paper they will be saying that failure to pass the suction tube, failure to pass the suction tube since there is atresia, and the patient on crying turns pink since the air goes inside and the blue patient is turning into pink color. These are the findings. This is the clinical picture of this patient. Now what you are going to do in this patient? Okay, first of all I would like to say that what are the CT scan findings. CT scan findings of this patient. So as you can see here, can you see this black color area? This black color area is your nasal or nasal cavity. Okay, air always appears radiolucent. Okay, lucent. Air is radiolucent. Let me draw that one here. What is air appears as radiolucent? Lucent means dark. Okay, air appears dark or black in color. You can hear the term called as radio dense. Whenever you hear the word dense, it appears in white in color. Okay, so as you can see here in the nasal cavity, the air, this air thing is very dark in color, so it is radio dense. Okay, and as you can see here, this is the nasopharynx here. This is the nasopharynx, and unfortunately there is a blockage here. I'll draw this one in red in color. As you can see here, there is red in color, right? This red in color is nothing but the atresia or the or the membrane. Okay, there is a membrane forming here. That's why there is choanal atresia, and hence the air is not able to go from the nasal cavity to the nasopharynx. Okay, so that is the CT scan finding of this patient. So what is the treatment for this patient? The treatment for this patient is you place a wide bore nipple, or we can simply call the McGovern's technique. Okay, the McGovern's technique. In this, we usually keep the whiteboard nipple into the patient's mouth so he can breathe through the oral cavity. Okay, so as you can see here, this is called as the McGovern's technique. And not only that, if this fails, usually we do tracheostomy. And eventually, now please listen this carefully, we will do recanalization surgery. The surgery is called as the recanalization at the age of 1 year. Okay, we will not do it immediately, we will do it at 1 to 1.5 years. Now why we are doing this after 1 year or 1.5 years? The answer is simple. Like old people and neonates, they are not fit for surgery. Okay, since the recanalization it requires some healing to take place, so which will happen after 1 or 1.5 years. Hence we will do this recanalization surgery only after 1 year or 1.5 years. So that is the choanal atresia part, and I discussed everything regarding the differences between cona and concha, how the clinical diagnosis or the clinical picture of the patient is made, and what are the CT scan findings, and what is the treatment. The treatment is the most important part. Regarding the treatment is that you do the McGovern's technique. Second, you do the recanalization at 1 to 1.5 year. Okay, so that was about it. Thank you guys.